To Madison now, and with weeks to go in the current legislative session, lawmakers there are making their final push for the bills that they want to see passed by the deadline. That includes one requiring hospitals to post their prices online in an easy-to-read format for patients. Spectrum News 1 political anchor Anthony DeBruzzi takes a look into why that bill seems to have stalled in the Senate with a vote yet to be scheduled.
Price transparency rules were enacted at the federal level in 2019 during President Donald Trump's first administration. Those rules later took effect in 2021, but some state lawmakers say they're not being enforced, which is why they want Wisconsin to have its own regulations.
Politics should never come before patients, and I'm afraid it may have in Wisconsin.
That's the perspective from the group Patient Rights Advocate, which believes lobbying groups are holding up leaders in the legislature.
I think it's important to note the Hospital Association never wanted price transparency in the first place. When President Trump got this done in his first term, they sued to keep their prices hidden. This is not something hospitals want to do.
Republican State Senator Julian Bradley knows that too. He's spent years pushing to, in his words, remove the veil.
In no other industry do you purchase a service and then find out how much it costs afterwards. We have overwhelming public support. Over 97% in my district alone said we need to make this law.
But that support is hard to come by among providers. Ascension Wisconsin, Aspirus Health, Aurora Healthcare, Bell & Gunderson Health System, Freighter, Marshfield Clinic, and SSM Health all oppose the bill. The Wisconsin Hospital Association is also against it, having previously raised concerns about how the proposal could conflict with federal rules and lead to more regulatory confusion.
We addressed some of the concerns they had about going right into the fee schedule by making sure that if there is an issue, if they're found to be non-compliant, they can go through a corrective action plan, which would keep them from being fined. So if there's any concerns about that, that buys them the leeway that they need. But at the end of the day, this bill is to make sure consumers are protected.
According to Turquoise Health, a national leader in healthcare pricing data, 74% of Wisconsin hospitals are meeting both federal requirements. But Patient Rights Advocate argues Bradley's state legislation would be stronger.
They keep saying, we're showing our prices. We're giving patients estimates. That's not good enough. Estimates are not real prices. They provide no accountability and often end up thousands or tens of thousands of dollars more than quoted.
Unlike attempts in recent years, the latest version of this bill passed out of committee in the Senate, meaning it is gaining political momentum, even if it doesn't reach the floor for a vote in 2026. Anthony DeBruzzi, Spectrum News.